Hi, I'm Dr. Will Gibbs, and this is Good Medicine. Today, we're talking about obesity and pregnancy. According to the American College of Obstetricians and Gynecologists, about half of all African American women are overweight or obese. So it's no wonder pregnancy complicated by obesity is prevalent in our community. I spoke with one doctor who serves a predominantly Caribbean patient base, and she says it's an issue we must take seriously.
This is a little boy. Keisha Gaither, maternal fetal medicine. It is an OBGYN doctor that has specialized in the care of high-risk obstetrics. We are in the heart of Brooklyn, so the bulk of the patients that I see are Caribbean. Of our patient population, about 88% are African American, and of that, I would say about 60% are Caribbean. Moms that are heavy tend to have babies that are heavy. Heavier moms can have babies that have congenital abnormalities, specifically abnormalities of the baby's brain and the spinal cord. Obesity precludes you to having diabetes and hypertension, and babies of moms that are obese tend to be heavier, and those children in turn tend to have an increased risk of having obesity themselves and the things that go along with it, like hypertension and diabetes. The first thing, it's important to have prenatal care. The earlier, the better. Problems can be identified very early, and if we know that we have a mom that has particular conditions, specifically if she's obese and is diabetic, we can see the baby earlier to make sure there are no congenital anomalies, place them on a diet if need be, make sure that they have the testing of the baby to make sure that it's growing adequately, make sure it has no congenital abnormalities, and if she needs a C-section, at least we will know ahead of time that the baby is large and schedule a C-section appropriately, as opposed to her coming in labor and then having complications thereof. If you have an obese patient and we know has a large baby and she's non-compliant with coming in for prenatal care and she shows up in the middle of the night in labor and the labor progresses, the worst case scenario is the head can come out but the rest of the body won't. Okay, and that's called shoulder dystocia. So that poses a significant problem, obviously, to not only the baby, because they can die, but to the mother as well, because she can, hemorrhage or bleed to death from that type of complication.
Dr. Gaither also says if you're planning to get pregnant, start healthy eating habits right away. You'll lose some weight and possibly increase your chances of getting pregnant. And if you feel you need some help shedding those extra pounds, it's best to see a weight reduction specialist. I'm Dr. Will Gibbs, and you just got a dose of good medicine.